The areas we've been real interested in is when people enter a wellness center, how are they doing in a number of domains? So not just fitness, but how am I also doing in terms of nutrition, how am I doing in terms of my relationships, and how am I doing in terms of my stress level? And the area that I've really been focusing in on is how does stress relate to other behaviors? So we were interested in, could we ask one simple question about stress? So as a psychologist, of course, I love to ask people 30-item questions, but we said, let's just ask people to rate 0 to 10, what's your stress level like? 0 as bad as it can be, 10 as good as it can be. So we gave a survey out to almost 14,000 people joining our new wellness center. And we just looked at, on one simple stress scale, 0 as bad as it can be, 10 as good as it can be. Do I have a bad level of stress? So did I say a 0, 1, 2, or 3? We found over 2,000 people had a bad or high stress level. If you had a high stress level, we also found in terms of health status, those individuals were more likely to have weight problems, high blood sugar, high cholesterol. So they came into the program with more health problems. Then when we looked at the health behaviors, and that's the area that I'm more interested in, we found out that the employees with a high stress level also reported their overall quality of life as being less. And then they also reported fatigue. And fatigue's an interesting question because fatigue can be, I'm physically tired. I helped a good friend of mine move into a new apartment, so I'm physically tired, but maybe I've had a family member in the hospital, so I'm emotionally fatigued. So fatigue kind of gets at both components. And we found that people that were high stress level reported more fatigue after a typical day and also more fatigue after walking up 2 flights of stairs. So it's probably getting at both physical and emotional fatigue. If you look at what helps people make changes, confidence is real important. Do I think I can succeed at something? And then support is also real important. Do I feel like people are supporting me in what I'm doing? And we found that the high stress people also had less confidence in their ability to have healthy lifestyles and also reported having less support. So putting it all together, what we found is employees with a high stress level had more health problems, lower quality of life, more fatigue, less confident that they can make changes, and less support for making changes. So this would be a group of people that could probably benefit from some individualized services in a wellness center. One of the areas that's being looked at in wellness is something called presenteeism. And presenteeism, I always think it's positive, like when I'm at work, am I actually present at work? But presenteeism implies the opposite. When I'm at work, am I thinking about other issues? And it makes sense for all of us. Maybe I have a loved one who's getting diagnosed at a hospital and I'm at work and I'm just thinking about what are the tests going to show, when are they going to get the news? So it's difficult for me to concentrate on work at that day. So some studies have shown that people with a high stress level might have high presenteeism. But we're also finding that a lot of people that would be seen as positive employees, high achievers, also report having a high stress level. Because high stress doesn't mean that I don't like my job and I don't like everyone I work with. It can be the opposite. I really like the people I work with. I really like what I'm doing for a living. So I really want to do well at it. I really want to be the high achiever. I want to make sure I'm a good part of my team member. So just because I have high stress doesn't mean I'm not a good performer. And so the two don't have to be matched together. When you think about someone joining a wellness center, a lot of times we ask fitness and nutrition questions, but we don't ask behavioral questions. And so what might be the best behavioral question for me to ask in order to identify somebody who could benefit from some specialized programs or some extra support? One area would be just to ask someone about stress. And we found just asking someone, just tell us what your stress level is, 0 to 10, identified employees with health problems and low confidence. But we're also wondering about, what if we just ask someone about their confidence level? You've just joined a wellness center. How confident are you that you're going to be able to continue in the wellness center over the next year? And we're also looking at that question, and we're finding people with low confidence are also the ones that are likely to drop out. So now we're wondering, maybe it's 2 questions. What's your stress level like, and what's your confidence level like? And maybe it's putting those 2 questions together. So there's a lot of exciting directions to go with this.